Anna,
Yes.
I'm not sure that the pinning, unless it's something on my end.
So welcome to tonight's session, everybody. This is a joint collaboration between Colorectal Cancer Canada and Hope and Cope, our wonderful community partners. Thank you for the support and for helping us to organize this. So welcome to Addressing Pain and Anxiety Through Acupressure and Auricular Therapy. I'm going to introduce you to Thi Tran. So many letters after your name, T, and I don't know what all of them mean. So maybe you could give us a little bit of a tutorial there, but you graduated in physiotherapy, acupuncture. I'm going to really mess this word up, Qigong. And also you have a diploma in Oriental medicine from Kansas College of Chinese Medicine. Mr. Tran currently practices physiotherapy, acupuncture, and is also a TCM practitioner for the Sir Mortimer B. Davis Jewish General Hospital here in Montreal, where he also participated in various studies on the use of Qigong in patients with cancer and the use of acupuncture with the same clientele. He also has provided training on the use of Chinese pharmacopoeia products for cancer patients. He participated in the writing of various studies, both in Canada and in the United States. Mr. Tran has presented at various conferences on these subjects, as well as on the use of acupuncture in the context of managing symptoms of various health conditions. So with no further ado, I will pass the proverbial mic over to T.
Great. Thank you for the introduction. Good evening, everyone. Thank you for joining us. What I'm going to do is going to give you just a brief overview of what I do at the hospital, and mainly with oncology patients. And then I would like to maybe have enough time to show you how to do self-acupressure and auricular therapy for symptoms management. Quite simple. Then I believe that everyone can do it. But let me just start by telling you my journey, how I got to work at the Jewish in oncology department. You know that I practiced Oriental medicine, or we call complementary or integrative medicines. I'll talk to you about the terms so that you know what's the difference between complementary, alternative, and integrative. Because if you speak to medical doctors and you use the wrong term, then perhaps they were not going to like it. But a study in Canada determined that almost 67% of patients use CAM, which is a complementary alternative medicine, in the form of herbal medicine, dietary supplement, vitamins, and also alternative practitioners, TCM, acupuncture, naturopath, chiropractic, were visited by 40% of them, and only 50% of patients informed the physician. So that's a problem when you work within the hospital setting. That's it's not safe for the patients, even and for us to not knowing what they're doing. So with that, this is a term. CAM is complementary alternative medicine, is the term for medical products and practices that are not part of standard medical care. Standard medical care in the hospital setting is medicine that is practiced by MDs and also allied health practitioners, such as physiotherapists, physician assistants, psychologists, registered nurses, OT, and allied health professionals. There are different practices, a biological based practice. The red, underlying red, like herb, qigong, acupuncture, meditation, traditional Chinese medicine, is that what I am practicing at the hospital. Complementary therapies, this is used as adjuncts to mainstream care, are supportive measures that help control symptoms and enhance well-being and contribute to overall patient care. Alternative therapies, conversely, are often unproved and disproved, promoted for use instead of mainstream treatment. or our offer is viable therapeutic options. This is especially problematic in oncology when delayed treatment can diminish the possibility of remissions and cure. So oncologists and MDs, they don't like to use the term alternative therapy because you're going somehow against the conventional therapy. Integrative oncology is what we're using at the hospital. It's integrative oncology is the synthesis of mainstream care and non-pharmacologic, evidence-based complementary therapies for the control of cancer-related physical and emotional symptoms. So we practice, all the treatment we do are based on scientific evidence-based and best practices. So this is the General Hospital in Montreal. I work for the Peter Broizy Lung Cancer Center and the Cancer Nutrition and Rehabilitation Program of McGill University at the Jewish General Hospital. The move into the integrative model of practice were mainly patient-driven. Over 6 months period, we did a survey of our patients in the Lung Cancer Center, and the survey revealed that 80% of the patient had turned to complementary therapies after lung cancer diagnosis. So then in March and 2012, the team moved into the new 10th floor center created designed to support integrative practice of this team of mainstream and complementary practitioners. And the team currently consists of pulmonary oncologists, nurses IPO, thoracic surgeon, dietitian, TCM, massage therapist, and physiotherapist. And we also consult with social workers and OT as well. So it's actually a blend. It's a blended interdisciplinary disciplinary approach combining philosophies and evidence-based practices of Western medicine, Chinese medicine, and other complementary therapies to promote treatment efficiency, relieve symptoms, and improve health, healing, and quality of life. Clinical implementations, evidence-based clinical practice guidelines on complementary therapies for patients with lung cancer identified acupuncture, massage, and mind-body therapies as safe and effective. So with those recommendations, the center began to offering acupuncture, massage, qigong, tai chi, mindful relaxation technique, and visualization. And TCM at the Peter Broizy Lung Cancer Center includes acupuncture, qigong, tai chi, and we're moving into Chinese herbs. But in Quebec, Chinese herbs medicine may only be introduced into the clinical setting via randomized control trials. And actually, we just finished the first phase of clinical trial on Chinese herbs, and we're going to start the second phase pretty soon. So I'm going to share with you what we have done so far in terms of clinical trial and studies at the hospitals. Let me see. So because we know that evidence suggests that acupuncture is a safe, effective therapy that has been found to reduce, especially pain, chemotherapy-induced nausea and vomiting, depression, anxiety, and neuropathy. Those are there are studies that support the use of acupuncture for these symptoms. So the place of acupuncture or acupressure in clinical care, cancer care, are for pain, chronic fatigue, post-operative and chemo-induced nausea, vomiting, dry mouth, post-radiotherapy, anxiety, depression, and insomnia. I started the very first clinical trials with the qigong classes at the Hope and Cope Wellness Center. This is the Hope and Cope Wellness Center in Montreal, and these are classes that we conducted for qigong and integral tai chi. We did a clinical trial on the effect of qigong and the effect of CNRP, meaning the Cancer Nutrition Rehabilitation Program, without qigong. And you can see the pre and post score after Qigong training. In the red over here, depression, nervousness, quality of life, and insomnia all improved significantly after about 6 weeks of Qigong training at the Hope and Hope Wellness Center. So then we did the second clinical trials in terms of DCMs using acupuncture for the management of cancer patients. And you can see also these are symptoms significantly improved when observed post acupuncture in well-being, nervousness, pain, and depression. So these are changes in symptoms. You can see this is like a waterfall graph which identify each patient. There's 21 patients, and well-being in the negative axis, meaning is getting better. Like on the ESAS score, for example, well-being is 10 or 8 is high. Then there's reduction in the score, meaning it's getting better. Nervousness, pain, and also depression all improved. And there's also a change in well-being and the number of sessions. There's a correlation between increased well-being with increased number of acupuncture or acupressure. So the results suggest that acupuncture seems to be effective in reducing symptoms related to treatment of cancer itself and to promote well-being in cancer patients. So knowing that Qigong and acupuncture are beneficial and helpful in the cancer population to reduce pain, anxiety, and depression, and improve quality of life, we decided to do another clinical trial in the role of integrative oncology program, meaning that we now combining exercise, nutrition, acupuncture, and relaxation techniques to maximize potential mind-body interaction and optimize symptom control and function. And that's what we did. So we combine exercise, nutrition, acupuncture, relaxation technique. And the results showed that significant improvement was observed in symptoms of fatigue, strength, because we started to also not only the acupuncture, but also an exercise program, aerobic and strengthening exercise program as well in the gym. Overall quality of life and well-being also improved significantly. And since we did the, now we also included objective test, which is the 6 minutes walk test. And it shows improvement in 6 minutes walk test post treatment from 413 meters at the beginning and to 471 meters. So you can see aerobic cardiovascular endurance has improved. STS means the sit to stand test, when meaning the seconds, the time it takes for you to perform sit to stands, standing and sitting down twice as fast as you can. It improved from 4.3 seconds to 3.4 seconds. So it took less times for a patient to perform sit to stands 2 times post treatment. And weight also improved from 69.7 kilograms to 71.2 kilograms because we combined and we integrated nutritional advices to the program. So you can see, again, well-being, nervousness, pain, and depression, all these symptoms improved significantly with the combined treatment. So the results show that a multimodal integrated program using nutrition, exercise, acupuncture, and relaxation techniques is feasible in a mixed population with lung cancer. This is the last things that we want to be able to do for the program is to identify Chinese herbs effective against lung cancer, and also to evaluate the effectiveness and efficacy of Chinese herbs. So we just, like I mentioned, we just finished, we published actually the first phase of Chinese herbs study, which we found that it's feasible and acceptable by the patients. And we didn't find any interaction with chemotherapy because we were giving patient a Chinese formula, herbal formula, together in conjunction with chemotherapy, and there was no interaction observed. You have any questions? And before we, this is just to give you a overview of what we do at the hospital, and it's feasible, and this is actually beneficial and helpful for pain, nausea, vomiting, depression, insomnia, and
Anxiety, you were mentioning. Anxiety as well, which is
Yes.
obviously a big part of the cancer experience. Just actually one question that came in, T, is the lower ESAS score is the goal. The lower the score, the better.
And ESAS scores, like for example, pain. 0 is no pain. 10 is extremely painful.
Right.
So
0 is,
it's a scale of 10. So there's 10 questionnaires that we, for example, nervousness, if your anxiety 10 is like you're extremely nervous, or dyspnea, shortness of breath, and pain. So clinical significance means that if there's a decrease in 2 points, let's say from 10 to 8, 8 to 7. So if there is a decrease in 2 points on the scale, consider clinical significance.
Okay. In other words, a reason to be concerned.
Yeah.
Yeah.
It does. Usually we always ask when the patient comes to our program or to our department, we also give them a questionnaire, ESAS, so that we know the symptoms. So which we usually anything above 5. So that's give us an idea. So that we have to, that's flags us, and then we have to intervene.
Right. Okay.
Yeah.
Yeah. It's basically just, you know, a common language to speak with the team.
Yeah.
Yeah. Okay. Sorry. Go on.
No problem. So that's to give you an overview what we do, and now that I think that we're gonna embark in the more like the theory and the mechanism of how acupuncture will work. Well, I mean acupuncture because I use the needles, but for acupressure, it's the same theory. It's another form of stimulation. It's the sensory stimulation. Either instead of using needles, we're using fingers or digits or a pen to exert pressure on the acupuncture point. And then because it's through neural pathway that how now scientists that confirm that's how it works. Then if you apply acupressure, it works. It will work the same way. It's through the same pathway, neural pathway.
Okay, so it's just different tools essentially.
Yeah, right. I also use laser acupuncture or non-invasive electrical stimulation in the patient. Let's say during chemotherapy, their counts, like white counts or platelets or neutrophils are too low. We don't want to use needles because in an invasive technique, it might cause bleeding or infection. So we always have to look at the blood result before we have criteria, and so that either we choose needles, acupressure, laser, or electrical stimulation.
Yeah, so it's interesting because as I was reading about it, it was saying that actually, and I think this is probably one of the highlights of this therapy, is that patients can actually learn to do it and do it at home because it doesn't require these specialized tools.
Yes, exactly. Yeah, and this low cost is easy to access. Everyone can do it. And it's quite easy to learn too. You just need to, you don't need to know all the philosophy or TCM theory in order to know, because it's very hard to understand in order to understand why acupressure works in terms of TCM, because of the chi, the energy, the blood, the 5 elements. Is that because even when I had a hard time to present my proposal for study at the beginning to physicians, because I was was very excited to tell them about the TCM part, like the acupuncture, the qi, the blood flow, the yin and yang. But I guess you don't speak the same language. And
Exactly.
so,
Western medicine does not speak
yeah,
the same language. That's
yeah.
it.
Then I shifted to my thought into like maybe I have to explain to them in terms of neural pathway, molecules, neurotransmitters, something that they. So that's what I'm going to try to share with you. Why it works, because it's, if you talked about chi energy, because it's, you cannot see it, you cannot really treat it.
Right.
Yeah.
Right.
Yeah.
So
So
I mean, it's interesting. You must do a lot of teaching, a lot of training of sort of Western culture, medical staff, and just so that they're on board with it and can kind of collaborate with you in that way.
Yeah.
Do you mind if I go to a question? Are you done with the presentation, or you prefer to?
Oh no, we have more, but if you let me know with this, I think it's better to talk and question and answer like that. But I think it's also to answer a question that you sent me previously, like why, if someone was asking why if it's effective and it's helpful, why we're not using it.
Yeah,
it's exactly the answer is we have to produce or to conduct studies so that we can show it's effective, but you have to be able to prove it scientifically. Then you'll be able to do it. And then they will, like, for example, at this time at the hospital, oncologists are very comfortable referring patients to me. Actually, nurses too. They don't need to go to the doctors and nurses. If, let's say, an ESS score anything above 5, then they're sent to me for acupuncture or for meditation, for visualization, or for Tai Chi Qigong.
So there's a specific cutoff, or
okay. But there's also recommendations from let's say from the chest or from pulmonary division that, let's say, if your pain level is persists above 5, on narcotics, then you might want to combine something like acupuncture or acupressure or visualization to help to decrease pain, and also to so that you don't have to take too much narcotics as well.
I think this is a great segue to the comment from Fabienne, which was related to the question you mentioned, Hannah. Fabienne wrote a comment about that at their hospital or treatment center, there's reluctance to tell patients about using supplements or natural supplements or herbs, because the pharmacists feel reluctant that there's not enough information or studies about the interactions with chemo. And you just mentioned a couple of studies that you've been a part of. I wonder if you could respond to that comment.
Sure, of course. You see, we have the same problems at the hospital. It's just the fact that sometimes they come, and this is quite like dangerous of patient taking something like herbal therapy, vitamins or supplements without telling us, because there might be potential interaction with chemotherapy, and the pharmacist will tell you, for example, not to take too much of green tea, something like that, not more than 3 cups, because it has antioxidants, so it will protect the cells from so it will render chemotherapy ineffective. So those are things. But you see, we want to do the first phase of the herbal therapy that we did for a lung cancer patient is just to answer those 2 questions. Is there any interaction? Because oncology doesn't know, because not because they don't want you to take it, but they since they don't know, they will say no. So because the patient already knows that they would have a no as answer, they would not tell them, the oncologist, if they want to take something. So to answer those questions we had to do a study, a clinical trial, so that we measure liver function test, we measure the kidney, and also we look at symptoms, interactions, and we didn't find anything. Actually, in fact, we found that somehow the formula that we gave to the patient during the first phase actually it helped to reduce CRP, which is a inflammatory markers. And also we found that through the ESAS score, we know that they're less sleepy and they have more energy. So the second phase is to of the study is to have a control group so that we know actually is it happening because of the herbs or because of something else. But if you ask for pharmacists, we usually send question to the pharmacist, but even though there might be potential interaction, they will say no. It's not sure if there will be, but
they don't know enough about it. Maybe.
No, it's just to be safe. So, but to let you know, in the formula that we use for cancer patient, lung cancer patient, there are 23 herbs combined together. 23. That's a lot of. It's a classical formula. But if you identify each single herb, for sure you say no, you can't. You cannot take because this will interact with that. But in Chinese medicine, sometimes just like when you combine two herbs together, it could be like it's not like 1 + 1 = 2. It could be 3 because it's the molecules that release from one herb will interact and then create something else.
Okay, so depending on the combinations.
Yeah, it's the combination. Okay. Rarely there's actually in the formula, traditional Chinese medicine formula, there's rarely you use, like, I think we never use one herb.
Yeah.
Because it's there's a synergistic blend when you blend different herbs together.
Yeah. Thi, do you know of another hospital that has somebody like you on staff, or do you consult with other hospitals?
We just had accreditation at the hospital.
Yes.
That came and visit our hospital, and we would think that we are the only hospital in Canada.
Wow.
In order that we're doing something like this.
Yeah.
And other hospitals like French hospital in like Maison Rosemont,
yep,
they reach out to us, and I gave some talk to a radiologist over there, and then actually we were able to establish a Tai Chi or group over there.
Okay. Okay, yeah, so great. So it's spreading out a little bit. That's really great.
But the problem is, I think, to answer the same questions, why not using more often is because in Quebec we don't have the how do you call it, professional code for a TCM or acupuncturist to be able to work in the hospital.
I see.
So you cannot really hire someone to do it.
It's a matter of certification.
Yeah, I'm lucky because I'm a physiotherapist. So I work
the loophole.
I'm wearing 2 hats. So I'm a physiotherapist, but loaned out to do research.
Wow.
I think that's a great segue actually to the question that Kim just put in the chat about accessing. If someone in Quebec or elsewhere in Canada, it sounds like it's very unlikely to have access to these kinds of services through their hospital or treatment center. So if they want to access someone like you that provides complementary therapies, is there some sort of registry that they can access to know that they're accessing a sort of competent and well-educated professional like yourself?
I'm not very sure. In Quebec, for sure, there's an order of acupuncture Quebec, but the fact that acupuncturists here in Quebec are not allowed to do herbal therapy part because they're not trained to do for the herbal therapy part. But in Ontario and BC and other parts, BCM practitioners are allowed to do herbal therapy, but mainly a private clinic, not integrated within a hospital setting. But that's my goal. I would like to do as much study as possible to prove that this is safe. But it has to be, I think it's best to integrate this within a hospital setting where you have an open conversation with the oncologist and the staff, a medical staff. It's like two-way communications. Because if you, let's say, if you don't have access to lab works or imaging, because all of this is good, but there's also precaution and also contraindication. There's things that, for example, if a patient has a bony metastasis in the lumbar spine, L4, L5, and then the lytic lesion, and is like prone for pathological fracture. And when you have pain, your muscle go to spasm to protect that segment. And let's say if you puncture, if you use acupuncture to ease the pain, if you puncture or you stimulate release muscle spasm of the paraspinal muscle, then that's the protective mechanism, it's gone. So then your spine collapse. You're gonna have cord compression.
Oh, wow. Okay.
And also, if you see things like that, like you have to have, I guess, there are red flags that you have to be very careful. For example, treating pain. If pain persists after you treat for like 3-4 weeks, then you might look at all the
Not be responding
symptoms.
to it. Okay.
Yeah,
Okay.
and also like you have to look at like, do the patient has any weight loss issue?
Right.
You all the symptom too, not just concentrate on just the pain,
So a patient has to be in a certain physical state, a well enough, I would say, physical state, in order to undergo this kind of treatment.
You don't have to, but
No?
you need to. That's why once you know, let's say you have like a lytic lesion in the lumbar spine, then you don't want to, in order to relieve pain, you don't want to puncture or do pressure directly on the muscles itself, but you can do auricular therapy. You can do points in the ear that influence other neurotransmitter to release in your brain to ease the pain without releasing the splinting or the protective mechanism of your body.
Okay.
Yeah.
I wanted to just there was a couple of questions just before we go on. Maybe then we can continue on, because I really want to hear about this auricular therapy. I find it so fascinating. But so our patients at Colorectal Cancer Canada obviously are, specifically digestive cancers, and so one of our attendees was asking about pressure points either through the acupressure or the auricular therapy that are known to potentially reduce gas, cramping.
Sure. Yes.
Okay. Yes. Are you gonna, if you're gonna be addressing that? I don't want to.
Yes, I'm gonna. Let's go to directly to that. Maybe it's better than going through all this and theory and mechanism of how it works.
Yeah. Perfect. Yeah. Perfect.
So let's see. This is just to show you that this is when I talk to the medical staff, a physician. This has to go with the limbic system, neural pathway. This is actually it's related to why it works. So I'm just gonna maybe talk a little bit about on this slide. Recently, neuroscientists from Harvard University found that acupuncture stimulation can reduce systemic inflammation in mice, in the animal model experiencing cytokine storm, which is the an extreme immune response in which the body rapidly releases excessive inflammatory protein. And such dangerous and sometimes deadly inflammation is the hallmark of sepsis and has been seen in COVID-19. And they found that if you stimulate on the points around the lower leg, hind leg, it's very close to the nerves, your nerves and all this, and it actually triggers a response through a nerve pathway called vagal adrenal axis that's been shown to calm systemic inflammation. And interestingly, the vagal adrenal pathway could be excited only through the legs, not the abdomen. So that's a way that now they know why abdominal acupuncture for gastric issues like bloating, appetite, pain doesn't work. So, but that's why I'm going to show you a few pointers I've used are mainly below the knee and below the elbow. So nothing on the thoracic and nothing close to the internal organs and the auricular ear. So it's very safe.
Okay, so just to recap, I'm not sure that I got this correctly, but to address any abdominal, cramping, gas, bloating, pain in the abdomen, it would be below the knee. Is that
yes, below the
okay?
knee. Yeah.
Okay.
Actually, they found that they always know that somehow points below the knee will help abdominal pain, but they didn't know why. But now they know, because the neurons in the legs are like 3 and 4 times more than in the abdomen, and especially in the fascia, in the front muscles of the legs. And the
Wow.
actually the point of for nausea, abdominal issues is on the stomach 36, which is right here. I'll show you. And the vagus nerve. Let's not talk about this because a little bit, but it's actually through the vagus nerve system, and autonomic nerve system is how it works. And because you see on the screen, the vagus nerve is this one. It's actually it's the cranial nerve number 10 of the 12 pair of cranial nerves that communicate with the internal organs like the lungs, the heart, the stomach, all the GI structures. So if you are able to stimulate the vagus nerve, increase vagal tone, you will be able to calm the pain of the stomach because of this connection. We call it, you've heard it before, guts and brain axis. Like the guts and brain axis, there's the guts affect the brain affect the gut. And this is actually through this vagus nerve, that's how things happen. And then I'll show you, and then this is why auricular therapy works, because there is a branch of the auricular nerve. Sorry, where is it? You see there's let me see. Because there is a branch of auricular nerve. Let me show you. Here, you see on the screen, you see there's the auricular branch of the vagal nerves that supply the external surface of the ear. So right here.
Okay.
There's a branch of the vagus nerve that exits, and that's the only peripheral branch of the vagus nerve that you can access externally to influence the vagus tone. So that is why auricular therapy is how it works.
So
this
that
pathway.
Okay, so that being said, you were saying the connection between the auricular, between the vagus nerve and abdominal issues. So does that make auricular therapy really a good alternative, or
yes,
good complementary medicine specifically for
yes,
digestive cancers and colorectal cancer?
Yes.
Okay, interesting.
It's because of the vagus nerve.
Wow.
It's the main, that's the key.
Wow.
Because without the vagus nerve, they did it, the study in mice where they cut the vagus nerve, nothing gonna happen. There's no activities of the gastric motility. So it has to go through the neural pathway, either from the ear or from the lower leg.
Interesting.
Yeah. So let's say, we'll talked about, but there's too many things to talk about.
Yeah. Ty, I think we need to go on the road with this.
Yeah,
It'd be a lot of symptom relief for our patients.
You see there's the green part right there in the concha of the ear. This is innervated by the only branch of the vagus nerve that exists on the external surface. That's the only area that you can access. Yeah.
Wow.
Okay, right there. Yeah, you see that's why these points in the concha of the ear, it's related to the vagus nerve, and when you stimulate this area, you activate the vagus nerve, and it sends a message to your brainstem, and the brainstem sends it to the brain, and then we'll go to and it communicate with the gut right here.
Incredible.
So that's why it's called brain and gut axis.
Uh-huh.
It's actually bidirectional, meaning it's the communication between the gut and the brain,
back and
brain
forth.
and the gut,
Okay.
back and forth. Yeah.
Fascinating.
And there are actually a lot of interesting study right now. The scientists are very interested in this. They call second brain of the body, which is the enteric nervous system, and how the central nervous system communicate with the enteric nervous system is through those pathway, neural pathway, or hormonal or immuno pathway. And then somehow when you stimulate this point, you are able to activate those pathways.
Okay.
So there you see they've done study where they stimulate the vagus nerve stimulation with electrical stimulation, and from there you send a signal to the brain, and the brain also communicate with the lungs and the stomach and the heart. Basically how it works, but we don't need to go too deep about that. So you see, here's the branch of the vagal nerve number 10, the cranial nerve number 10 connect. There's a branch to exit the external surface of the ear, and then these vagus nerves innervate the stomachs, the heart, the lungs, and also all the guts. So if by tapping into the stimulation on the external ear, you can influence activities of the stomach.
Wow. So just in terms of like when you say activate activities of the stomach, we're talking about sort of like a natural protection against pain.
Yes.
But without kind of going too much into this, because this would probably, be an entire thing on its own. But just, is this something that at least in Chinese medicine, they consider to be not necessarily a complementary, but a treatment?
Yes.
A treatment therapy. Yeah.
It's a treatment. You see TCM, they use auricular therapy, acupuncture to treat diseases. Like 3/4 of all diseases are able to treat just only by acupuncture and herbal therapy.
Wow.
But because that's the traditional Chinese medicine, that's what they use the most. Like for prevention, for like symptoms like mild to moderate intensity, and also to complement, let's say after surgery, to help speed up healing process.
That's what Kim was mentioning. Ostomy sites, to heal ostomy sites and such.
Yes.
Okay.
Yeah. You were asking how it helped with the stomach? Is because the sympathetic, there are two system of component of the autonomic nervous system. The parasympathetic system, which is a vagus nerve, which is the rest and digest, and the sympathetic nervous system is fight and flight. So there are two. One is active, one is like rest, just like a yin and yang in Chinese medicine. One is active, one is passive. But it has to be balanced between the two systems so that your body is at rest. But most of the time, we are always in the like overdrive mode or survival mode constantly because of external stimuli. So you are bombarded your system with sympathetic nervous system activity. So you always like so what it does is it slow down the gastric motility. So you digest you don't digest well.
Okay.
Just like
because
when you have
because the sympathetic nervous system is what gets overstimulated, I guess, right?
All the time. Yes.
And that's highly connected for a lot of people to the gastric, juices, etc., that end up getting secrered when people have overstimulation.
I've seen quite a few children, age from between 8 to 12, always have GI issues.
Yep.
In the morning when they go to school, either they have stomach ache, they have nausea, they're dizzy. It's because of overstimulation of sympathetic nervous system. Wow. And then over time, if you don't rest, you cannot really digest. You're always in flight and fight mode. Yeah. So your body is like, because past the slide previously, but it's actually the autonomic nervous system that we're not taking care of.
Wow. So and this kind of leads to chronic disease, right? A whole bunch of different chronic
long term conditions. because of guts. Just to have you an idea, when someone asks me, can you tell me how does the guts connect with the brain, and the brain connect with the gut. Because very simple. Let's say you worry. Let's say you might not have enough money to pay your mortgage for this month, and then you couldn't sleep. You couldn't sleep, and you have like that's why you said you have you worry sick, and you have a gut. You have like a knot in your gut. It's actually your brain. The tension transmits from your tension to the gut. But on the other side, when you have, let's say, a stomach infection or viral infection, so the nerves in the gut, this vagus nerve, will send messages to your brain, telling your brain that there's some inflammation or viral infection going on right now. So they will send a stress response to the brain. So the brain has to respond to the vagus nerve, like take care of it. So they have to send white counts, and they have to send they have to send anti-inflammatory molecules to take care of the guts. But if you don't take care of an infection, you're going to have an ongoing stress response.
Wow.
Coming from the gut.
Yeah, and so Jay actually just made a comment in the chat, and 100%. I mean, it's a great comment. This would explain why it takes so long to recover after cancer. Being in survival mode, in that your system's really overstimulated between what you're going through physically and emotionally and everything. That just delays the process, I would assume.
Yeah, I believe so. That's why I think that not only we have to treat physical symptoms, but we have to look at the mental aspect too, because that's actually that is because of the bi-directional up and down, and they communicate.
Mind and body. Yeah.
You have to somehow balance your parasympathetic nervous system and sympathetic nervous system, and you can do that via stimulation of the auricular ear point.
Incredible.
There's also therapies, physical therapies, that you can increase vagal tone, which is increase parasympathetic nervous system via meditation, slow, complex coordinated movement. They found that when you do, for example, Tai Chi, very slow, very complex movement, but coordinated. It's not just like bicep curl that you lift weight, because then there's no your parasympathetic nervous system doesn't kick in. Whereas when you do very slow rhythmic movement and breathing, especially, then you actually can increase vagal tone, which will then increase your sympathetic nervous system, and then your body will be able to rest and digest. Because otherwise, you will not be able to digest if your parasympathetic nervous system is not working.
Right.
Yeah.
Right. Okay. So we all have underactive parasympathetic nervous system.
Yes, I think we all do. Yeah, that's why the body will show you symptoms. The body will show symptoms, but because you just keep going, you don't allow your body to rest, and it will show physical symptoms like dry mouth, for example, dry skin, for example, things like that. Increased heart rate, and those are all sympathetic nervous system symptoms.
Wow, of an understimulated,
like or increased sympathetic nervous system.
Wow,
that's all. Like, if you understand that, then it makes more sense when you do certain things like breathing exercise, yoga, like humming, chanting, those things, or vagus nerve massage. You can help with all this to ease those symptoms.
Okay. Are we going to get to a slight demo after? I hope.
Yeah.
Awesome.
Here, let's do the. I'm just going to show you a few.
Sure.
This is the study they've done for anxiety and depression, and these are points that they're using, and it shows decrease in anxiety. And then I will show you all these points. Actually, I want to show you 9 points on the ear and 9 points in her body. And then if you know those 9 points, you're pretty good at helping your symptoms.
Wonderful.
And this is again a study. This is an actual study they did on vomiting, diarrhea, and nutritional status in gastric cancer patients. And these, you can see, these are points that you can use to stimulate. And now I'll go over those points with you. So this is the external anatomy of the external ear. So you need to know a little bit, a few areas, so that when I show you the points, you know exactly, you have an idea where it is. So this is the ear, external ear. I don't know if you've seen this. Have you ever thought about the ear as an inverted fetus?
When I read that, I was blown away.
Yeah,
No,
you
so
see the
that's really
babies in the fetus. This is the head, the spine, and like curling.
incredible.
And then that's why you see here, I think there. Well, I think I'm going to show you the points. Or maybe I went too far. Oh, there. You see?
Yes. Oh,
Yeah,
wow.
this is actually it's actually discovered by a French neurologist in 1957, Dr. Paul Nausea. He's a neurologist. The first originated concept of an inverted fetus on the external ear. And these are like babies in the ears. And also, if you observe, you see the heads right there, and the spine, the legs, all internal organs. You see all the internal organs is located right here in the concha.
Oh, that's fascinating.
Right here. And it would happen to be innervated by the vagus nerve, the branch of the vagus nerve. So when you stimulate all the internal organs, you're activating the vagus nerve. So, but in TCM, in like 1,000 years ago, they didn't know that about any neuroanatomy. So, but it's happened to be all the internal organ structures are located in this area. Also, if you look at the ear, you see this line right there. There's a groove.
Yep.
You see this like groove right there.
Yeah. What does that indicate?
This diagonal folds in the skin over the ear right here in the earlobe. And normally, it's if you see that, it means that there's like a coronary or cardiac issues in the patient.
Wow, I've seen that so much on, older clientele and.
Yeah, and then actually confirmed by medical professionals, like scientifically, that you see this line right there. You might be either blood pressure level or serum cholesterol level. So that's why there's the specific issue and disease process that you can identify in the ear. And actually, this area is for cancer right here and there.
So what would the area look like that would indicate that there was cancer?
There would be like change in texture.
Okay.
Or color, or but this one right there and right there, they observed like in oncology patient, these creases are indication of some kind of oncology issues.
Wow.
Yeah. But now you can see the okay, so now I think it's better to go straight to the point. I'm going to show you 9 points in the ear, which you can use for pain, anxiety, depression, insomnia, and to improve general well-being. And these are called master points of the ear. Can you see right there? I always use this point number 1, 2, 3, 4. These are it's just like a combination that you use for any condition, pain, stomach pain, anxiety, insomnia, because this is an axis. This is just like a brain and gut axis. The first one is called the point 0, right there. You can see why point 0. It's actually, this is where in the fetus is the umbilical cord, the placenta. The placenta, this is the connection between the mom and the babies, and this is happened to be the solar plexus or the stomach.
Wow. Meaning that that's where everything pretty much originates
Yes,
from.
yes. So it's called point zero. It's just like a reset point. It helps to balance everything. It helps to return into the state when you were in the baby. So
Wow.
it's very easy to locate. This is called the helix. If this is the root. If you run your fingers along this ridge, when this connect to the concha, the point is right there. Let me see if there's another point. See, this is called point zero right here. It's located where the
You frozen, T? You there?
you can address that too.
Okay. I apologize. I forgot to.
But because there are 5 points that I don't know if I can go back to the slide, but specifically for areas of discomfort or a problem, let's say face and headache, it's the points in the hand. Chest, the point is in the wrist. Stomach, the point on the lower leg, close to the knee. And then the lower abs below the epigastric area, anything below the epigastric region would be spleen 6, which is close to the ankle, above the ankle joint. So depending on the location of discomfort or problem, then you would stimulate that specific point. So for any kind of GI issue, you would choose stomach 36, spleen 6, and pericardium 6. Those are 3 points for. Would you like me to share and I can show you?
That would be great.
points?
Are you still able to share screen? Yeah, you can share screen still. And if at some point, T, you're able to send me the diagrams so that we can, with the points, the points in the ear and the points in the body, so that we can send that out to the attendees. I think that
Of
would be
course,
really
yeah,
great.
yeah. That's
Awesome.
my intention, because I
Thank
want
you so much.
to, that. Let's see. Oh, sure. Where do I?
Maybe while you're setting that up, T, I also wanted to tie into this a question that we had while you were off, which was about, now that we know some of these points that you showed us in the body and in the ear, is there something that patients can do on their own with those points to stimulate them, like at home?
Right.
Yeah.
Basically, yeah, of course. Once you know the location of the points, the body points you can use like fingertips or anything that you can stimulate. In the ear, because the point is small, because of the ear, you have to use we call auricular seed. It's a seed that you press and you put on the point. Once you localize the point, you put it on, and with a piece of tape, it's kind of hold the seat against that point, that point. And then what you do, you press on it, or you 3 times a day, or like 2 or 3 minutes each time. And when you're not pressing on it, the piece of tape exerts a pressure already on the external ear surface. And because there you have that auricular grain or seat there, there's always pressure on that point.
Okay.
Can you see the share screen now or no?
Yep. Yeah, we can.
Oh yeah. Okay. I'm not sure. I'm gonna show you the point of the stomach.
And then following that, if we can go to the neck and throat area,
Oh, neck and throat. Yeah.
Yeah. After that, thank you.
Yeah.
Can
you see the stomach 36 points?
Yep.
I don't know how to make it bigger.
Maybe view. If you go to view, up there.
What do you see now?
Top of the screen of your screen, view, all the way to the right, like on the toolbar there.
Let me see. Do you see anything on the share screen?
Yeah, I can see the diagram.
Oh, which one is it?
But if you go to view all the way at the top of the screen of your screen, it's in blue, you know, the different
I'm gonna go back again. Okay, now I think you can see it, right?
Oh yeah, perfect.
Okay. Okay, now I'm gonna go to that point. I'm gonna go to the point. Why it's not okay. Oh, here's the, you can see on the share screen, this is how you do apply pressure point on the ear. You see, this is the auricular seat. You peel, you place it on, and you press, you tape it on.
Oh, okay. So these are special materials.
Seats. Yeah, this is seats that you can see they tape it here on the point of the ear.
Okay, so someone doing this at home would have to get some.
Yeah,
of
you
these.
have to buy the seat, and then you just have to peel it off from the plastic film, and you place it just like a piece of tape on the location of the point, and you press it so that it adheres to the skin, and then you press on it.
Okay, where do you get these?
You can buy it at the acupuncture supply place. Because the patient that I see at hospital because of COVID, they've been doing this at home, and they buy the seats themselves. And then usually I have a family member come at least one time so I can show them where, so they can apply it for the patient, because it's very hard for you to do it on your own, especially on the ear. You can do it on your own with the body points, but it's very hard to put the seats on because there's the point is very small.
Yes.
Yeah, let's see. This is insomnia. We can go back later. This is a protocol that I would like to show you for things. Okay. Here, this is stomach 36. This is any problem with the epigastric region.
Okay.
The stomach, you use stomach 36 points. And how you find it is your kneecap. You locate your kneecap, and then you measure from the apex of the kneecap. 4 fingers of you put your 4 fingers together, and this considers 3 units. This is 3 units from the apex of the kneecap down to the shin bone. And then this is on the outer side of the shin bone, and you measure 1 finger breadth away from the shin bone. The point is located right there, stomach 36. And this point is almost very close to the deep cranial nerve. So when you press on this point, you're gonna feel a little bit like warm sensation, tingling sensation, or deep ache that might go down along. You see the nerve. This might go. Even though you put pressure there, you might feel some kind of sensation that would either going up toward the kneecap or down toward your ankle. So
that's how you know you're in the right spot.
Yeah, because
you'll feel this tingling sensation.
Or it's normally acupuncture points, or you will find there's a little bit of depression, and then when you measure it with the electric current. Normally it doesn't have a lot of electrical resistance. That's why it's actually sensitive. When you press a little bit deeper, you might feel like a deep ache. I don't know, you can try it and see if you can find it. So you find your kneecap, measure 4 fingers from the base from the bottom of your kneecap, and then 1 finger breadth away from the shin bone toward the outside, and you press on it. You're gonna find, or sometimes you can feel like even some tingling going down the foot. I don't know anyone can feel it, or maybe, or sometimes it's sensitive. It's like a deep ache.
Huh.
And this is all issues involving the stomach and the spleen, like abdominal, epigastric pain, bloating, nausea, vomiting, hiccups, diarrhea, constipation. This is all. This is the main point for stomach issues.
Wow. And so, you know, with this, we were talking to Fabienne, who's with us tonight, about her experience with acupuncture, and she was mentioning that you know, during the session she won't necessarily feel any relief or feel any difference. Is it the same thing with auricular therapy or with, you know, any of this acupressure? Would you feel symptom relief in the moment, or it really comes after?
If it's in moment, you might have to do a very vigorous stimulation, especially with electrical stimulation. You might have to hook up the needles and electrical, like a clip, to induce an external current to the point. And then let's say when they do surgery, before they do surgery, they usually use electrical stimulation on the channels to ease the incisional pain. But also depending on if you have like a massive lesion compressing on the celiac plexus, then you will not have immediate relief after insertion of needles or acupressure. The idea is, if you need to stimulate long enough, or you have to feel for that warm sensation, tingling, deep ache, in order to activate that nerve. If you're able to activate that nerve, then your brain will perceive it as a sensory input, and it will release serotonin or any other neurotransmitter to counteract the pain.
Okay, so yeah, so this is all about a release of serotonin, really, essentially.
Oh yeah, this is all neural pathway. This is exactly because you're gonna feel it. I'm not sure anyone can feel it already. I don't know if anyone found the point.
But I did not.
But stomach 36 is the main point for stomach issues, and also for the immune system as well.
Oh, for the immune system as well. Interesting.
Yes, you see, this is in the past. In the past, they would cauterize this point with the cigarettes or with something. So they would scar this point to increase the immune system. And that's what now, if you observe in the elderlies, and if you see a scar right there, it's probably because they had it done. They call moxibustion, or they scarred the points, and somehow they do it before the winter. It's just like a flu shot. It helped to improve the immune system.
Incredible.
And again, I think it's because of the fire, because you burn the skin that actually stimulate your nerve. And then your brain secretes a lot of neurotransmitters and hormones in your body. And that's what that's the same thing they found when they measure in blood serum, or there's increase in serotonin and endorphin, like almost 40% in the bloodstream after 20 minutes of needle stimulation.
Oh, okay, so they're, you know, Fabienne's asking, should we press the point for a long time? Does it minutes, seconds?
3 minutes if you can, and you just do it. It's a circular motion. You once you found the point, you just don't let go of the pressure, and you do like a circular motion, like pressure point. And it's also trying to breathe while you're doing it. Breathe in and out, and also think about the point. And if you can imagine this line, you see this is the stomach line. You see the blue line there? That's I point the arrows. This is the stomach meridian. And then when you stimulate that, just think about the meridian that connect to the stomach.
Okay.
Just to enhance somehow, you can enhance the vagal tone just by doing deep breathing, and then think about the channel and the organ itself. You see this is, it's connected to the stomach. That's why it's called the stomach 36, which is the meridian of the stomach, right there.
Yeah.
And I don't know, you can see the lines going all the way to the face, right there.
Gut-brain connection.
Yes, actually, is actually for Bell's palsy. It's for like a muscle weakness of, because they would puncture this point to treat Bell's palsy.
Really?
Because of the energy that runs along the stomach region. And this is also a point for the frontal headache. And normally frontal headache is usually due to stomach issues.
Oh, really? Okay, I thought it was sort of stress related, but interesting.
Well, it could be stress related, could be on the temporal, or also on top of your head. It's the liver channels. So depending on the area of the head, then you can choose points accordingly.
Fascinating.
So this is one of them, and then the next one for the stomach issue is the Spleen Six, which is this one.
Okay.
This one you might be able to find it because it's quite sensitive, because of the spleen is the care organ of the stomach, and normally it's quite sensitive. This is how you find it. It's you locate from the inside of your foot. You see this the medial malleolus. There's the bone, ankle bone, right there.
Yep.
So same thing. You measure 4 fingers, which is 3 units. And this time it's dry over the edge, the ridge of the bone, the tibia bone. And if you press on it, it might be sensitive. It sometimes can feel like a bruise. Anyone feels it?
I don't know. A lot of things hurt these days. It's hard to tell what's what. But, okay. And so that would be okay. So
this is an important point in the treatment of any digestive and dying emotional condition.
Oh,
actually, yeah. This is the point that I'm also collaborate with a gyne doctor from the CHUM. She specialized in pelvic pain and overactive bladder, and this point, because of it's right over the posterior tibial nerve, this is a procedure done by the MDs called percutaneous tibial stimulation with the electrical stimulation with the needles. And you can see, because of this nerve runs through the pelvic area, it actually it helps to this one is for any kind of pain below the epigastric or below the navel. So you have overactive bladders, you have pelvic pain, you have bladder pain or discomfort. This is the point that you use.
So continence is also something that's sort of managed or treated.
This one this is a good point for anything below the navel to the pelvic area. Wow. And you can see, because of this nerve, especially if you can do another pressure point over the sacrum area, over the third sacrum foramen, where the pudendal nerve exits, because this nerve innervates the genital area. So this one, when you stimulate, it eases the overactive bladder or any pelvic pain.
Okay. Good to know. On the liver. Okay.
Let's see this. Yeah, this one is for this one is another good one. If you any GI issues, you use P6, pericardium 6, stomach 36, and spleen 6. Those are the combination for GI and abdominal issues. And this one is for nausea. This is the one that they've done extensive study on for nausea, either chemotherapy induced or during pregnancy.
This is safe to use during chemotherapy, correct?
Of course.
While you're in treatment.
Yes.
Okay.
Yes, because this is non-invasive. You heard about the C-band, right?
C-band.
Yeah, for motion sickness.
Oh, yeah. The
Exactly.
bracelet?
This is the point that you have to put the C-band all on, because if not all on over this point, it won't work.
Okay.
So for nausea and vomiting, you can either do acupressure on this point, or you can buy C-band and you put that plastic knot right over this pericardium 6 points, right there. And how you find it is this is your wrist crease, and you measure this time just 3 of your fingers, which is 2 units. And if you make a fist, you're going to see 2 tendon pops up, and the point is right in between the 2 tendons.
Okay.
And
that I think I found.
Yeah. And this one is right over the meridian nerve. So sometimes if you press this hard enough, you're going to feel it tingling down the your palms and your fingers, because this is the nerve that's very close to it.
Okay.
And remember that each one has a specific region. This one is for the chest. This is for the chest, to open the thoracic cage, so that and also it helps with regulate your heart rate.
Okay, so that's when you're anxious. That's probably a good thing.
Yes,
to
exactly.
Yeah.
And or anxious, and it's like thoracic oppressions, and you feel like you cannot breathe.
Oh wow, Jay said he used those bands during chemo and worked brilliant.
Of course, yeah.
Most people don't know.
In Europe, in UK or in Europe, nurses are doing this treatment. Like they are allowed to do this for chemotherapy for patients.
Wow, smart.
Even I think MD Anderson's and in Texas, nurses are allowed to do it. Yeah.
Okay, sure. It's non-invasive, right? So.
Well, this is not invasive,
Yeah.
And I think you can do it on your own. You can do it yourself.
Yeah.
Just locate the point and massage it, and then put pressure for 3 minutes.
T, I think we could probably talk all evening, but I don't want to take up like too much more of your time. It's about 10 minutes to 9. Can we just sort of, do you mind going to address the throat? Jay had this question. Am I getting this right, Jay?
Yes.
Yeah.
The throat, there's 2 points. The throat, this is the one that you can use, large intestine 4. You see this line, large intestine 4, this dotted line, is go arm and go past the throat. You see right there?
Okay.
So it's good for any problem in the face, in the neck, and then in the head, right there. Like this is, So this one, actually, I think is another sensitive point. This is located at the second bone of your hand, and right in the middle, right? If you measure from use this bone right in the middle, you're gonna it's quite sensitive. You found it?
Yeah, I think I did.
Yeah, it's sometimes you are right on the point. You can feel like the whole palms is aching.
Yeah, it's definitely the more sensitive part for sure.
Yeah. So this is a good point. It actually strengthens the immunity if you combine with the stomach 36, and it helps with pain, and it regulates the face and head area. And in this is actually the spleen 6 and large intestine 4 points are prohibited if you're pregnant, because it's induced labor. It's actually it can actually cause uterine contraction. Normally, this is the point that you want to provoke.
I could have used that a few years ago.
Yeah.
Okay. Interesting.
And another one for the throat is because the vagal nerves innervate in the pharynx and larynx, right there. The vagus nerve that we were talking about before.
Yep.
Innervates the throat and the larynx and pharynx. So these are these points will help with the throat, and actually because you're massaging the vagus nerve, it helps to actually ease tension. You see, this is the point that the traditionally we used to help with the stress. And 1,000 years ago, I guess they weren't aware of this vagus nerve that run right over here. So actually, when you stimulate this, you actually doing vagus nerve massage stimulation. And if you activate this vagus nerve, you increase the parasympathetic nervous system, and you can calm, it's kind of calm, rest, and digest response.
So for example, like when would you, in order to get the maximum benefit from this specific stimulation, what would be the best time? I mean, to do this after to digest your food, like, is that, to help with digestion, or?
You can do it actually even like before, after. You do it actually 3 times a day if you can, because the idea is to improve the flow of the energy. You want to keep it open.
Okay.
You don't need to wait until it's obstructed, then you're trying to free the flow. But you have to try to balance this as well. You're trying to open the channels and then keep it flowing. Because that's the problem when it got stuck, or when it's too much and when it's too little, then you will create imbalances in the channels.
So preventative is obviously the best measure. Okay. Any sort of side effects, T, that come with this therapy that patients can expect to feel? Soreness the next day, or anything like that? Uh-oh. I think we have another power failure. Yeah.
Maybe we can give it a minute, and then, I mean, we're pretty
Sure.
close to 9, so
Yeah.
But would be nice to say goodbye properly.
Yeah, exactly. Exactly. What a fantastic session. I don't know about you, but I want to go out and do a set. I want to go out and find this is very interesting stuff.
I think what helps is that he truly believes in this research, and he gives it to his patients, which is really remarkable.
Yeah, it seems like he probably has really good connections and good interactions with his patients, and they trust.
And with his peers as well.
Yeah. I've heard, okay. Don't apply pressure to, this is Christopher with a tip. One tip I've heard is don't apply pressure to both sides of the neck at the same time, because if you compress both carotid arteries at the same time, you'll probably start getting dizzy. That's a really good tip, actually. Thank you for that, Christopher. Thank you for this great participation this evening, everybody. Really, really enjoyed your questions and comments, and it's always fun to learn together.
Hi, I just called T, and
Yep.
he still has the power, but his internet is unstable.
Yeah, so
sometimes he, lose the internet connection.
yeah.
And he said that if you want to close the session, just go ahead, and if anybody has question, just send him the email.
Oh, what a kind guy. Very nice.
Okay.